So my name's Megan Orlando. I'm an assistant professor and I work in the section of minimally invasive gynecologic surgery. My interest in medicine came from, I think, really wanting to care for people in their times of need and vulnerability, and also, kind of an interest in the human body and physiology and kind of combining those two together. And then in addition to that, I've always loved surgery in particular, just because of the ways that we can really provide people with definitive treatments for their conditions. I specialize in complex benign gynecologic surgery, and that's really the standard of care, in which the standard of care for most patients is minimally invasive surgery for benign pathologies. So I see a lot of patients with endometriosis, pelvic pain, fibroids, abnormal bleeding, among other GYN conditions. I think that it's really of the utmost importance to listen to my patients and really try to understand their story and their concerns rather than making assumptions or kind of jumping in with my own ideas. So I think that patients' lives are complicated, and it's important to know the ways that their GYN and reproductive concerns fit into the bigger picture of their lives, so that we can work together to find treatments that will really help them reach whatever those goals are. I think, in working with patients who often have the conditions that I see most frequently, pain, abnormal bleeding, I find that I often develop longitudinal relationships with patients and really get to understand them and their perspectives. I think those conditions are often stigmatized and undervalued just in general by our society, and getting the opportunity to work with somebody to combat some of those stigmas is really rewarding. And it's, I really value when patients can feel that they're respected and listened to.